Good afternoon, everyone. We will get started in just a moment. All right. Thank you for joining HHS Region 5, Protecting Yourself for a Healthier Winter, a conversation on flu, COVID-19, and RSV. My name is Betsy Weand, and I'm the Public Health Policy Advisor in the Office of Intergovernmental and External Affairs at the Department of Health and Human Services. This briefing is open to the public. However, the conversation should be considered off the record, and any press inquiries for HHS should be directed to the press office at media@hhs.gov. There will be time at the end for Q&A, so we encourage you to submit your questions using the Q&A function at the bottom of your screen at any time during the briefing. I'd now like to turn it over to today's moderator, Michael Carbonargi, Director for Region 5 of the U.S. Department of Health and Human Services. Region 5 encompasses Illinois, Michigan, Ohio, Indiana, Wisconsin, Minnesota, and 34 indigenous tribal nations. Director Carbonargi, the floor is yours.
Betsy, thanks so much. Hi, everyone. I'm so pleased to welcome you to an important conversation about how we can ready ourselves for a healthier winter and some of our best tools for protecting ourselves. Vaccines from influenza or the flu, COVID-19, respiratory syncytial virus or RSV. As Regional Director of the Great Lakes region, I'm proud to lead this webinar in support of the U.S. Department of Health and Human Services Risk Less, Do More campaign, which helps people risk less from severe illness and do more of what they enjoy this winter by sharing information and encouraging uptake of the flu, COVID-19, and RSV vaccines. We're joined today by a great group of experts from our co-hosting organizations. Karen Podolsky serves as Director of Community Affairs for Northwestern Medicine, working closely with community partners to help them navigate health challenges, including flu and COVID-19. Karen holds a master's degree in nursing. Dr. Artie Barnes serves as Medical Director and Chief Medical Officer of the Illinois Department of Public Health, and in her current and previous roles, helped organize the COVID-19 clinical and policy responses. Dr. Eric Makaitis serves as Chief Executive Officer of Cook County Health to advance the health system's strategic imperatives and ensure the provision of high-quality care and services. Dr. Makaitis is a board-certified internal medicine physician. Dr. Alexander Sloboda serves as Medical Director of Immunization and Emergency Preparedness for the Chicago Department of Public Health. Dr. Sloboda is an emergency medicine physician. And to our participants who are with us today, thank you. If you didn't submit a question when you registered, I invite you to ask your question in the chat box now. So let's dive into our discussion with our panelists. Today, we're going to talk about a very important topic: how to protect our health this season. For many, it's a season of celebration and gathering with family and friends, but it's also a time when we're more likely to be exposed to respiratory viruses. So I'd like to start with some basics. With so many people preparing for the holidays or trying to finish end-of-year work projects, why is it important to be thinking about respiratory viruses now? Artie, if you'd like to start us off.
Yes, and thank you all for taking the time to be here today and really focus on this important issue. Right now, we are starting to see a small rise in our three main respiratory viruses, COVID, flu, and RSV. And I think it's important to pay attention to what's going on in your community. These infections can be devastating for those who don't have the best protection against it. And whether it's your body's own immune system that's trying to defend against it, or the ability to just protect yourself in the work that you do and stay with your mask, get vaccinated. All of those things can really make a difference to how well you handle these pretty serious viruses this season. So we're starting to see an uptake in Illinois, and we have a lot of tools at our arsenal to find out, even at a local county level, how much is the burden of these infections in our community. So pay attention to those and try to protect yourself as best as you can.
Thank you, Dr. Barnes. Along with that, I don't know if Karen, if you'd like to share your experience in Northwestern, what are you seeing in terms of office visits, hospitalization, and other indicators of respiratory virus spread?
Sure. Just like Dr. Barnes mentioned about an uptick in cases, we've also seen uptick in severity as well. So those that maybe not as prevalent in the previous few years, but still definitely is out there. We've definitely seen a rise over the past couple of weeks, as well as an increase in severity. So it's important to kind of keep track of things and take care of yourself, especially now as we're gathering into the holiday season and folks thinking that you have a lot going on, stress is high, immune systems are wearing down, a lot of activities, a lot of close gatherings, the end of the school year seasons, it's the end of the right before the holiday, all those activities at school. So be careful. And it's so important right now to get vaccinated and take care of yourself.
Right. And Karen, while we're talking about the need and the importance of vaccinations, can you talk about what people need to know about how flu, COVID-19, and RSV affect people? What do these why do these viruses impact some people more than others?
Sure, they impact some people more than others based on their different components, whether it be your age, weakened immune system, the very young and the older population might affect them even worse. They might affect you if you have other comorbidities, other factors, diabetes, obesity, things that might be going on that might impact it even more. Just different things, as well as if you get one illness, you might be susceptible to another illness as well while your immune system is weak. So different reasons why you might be more susceptible than others.
That's right. Thank you. Um, Dr. Sloboda Alexander, can you talk for a minute about why different strains of viruses can impact people differently year to year? I think folks are maybe familiar with the fact that there's different flu strains, so every year's flu vaccine may be composed differently. But can you talk about the different strains of viruses and maybe some other factors like age or other illnesses that can increase a person's risk?
Sure. So yeah, every year for the past decade or longer, there's been new flu vaccines that come out, and they adjust those vaccines based on what kind of strains of flu A and B they think are going to be circulating in the population. And now we're seeing with COVID, many of us have heard all these different types of strains for the past few years of COVID-19. And that's one issue with COVID-19. It is constantly changing, it's constantly evolving. And so that's why now we're coming out with these new updated vaccines. So even though you had vaccines for COVID-19 early on in the pandemic, 2020, 2021, they may not be affording you the same level of protection against these new strains that are coming out that are kind of evolving over the past year or so. So last season, we had the first updated 23-24 COVID-19 vaccine to protect for those new kind of COVID-19 variants that we were seeing. And then again, they updated the formulation for the COVID-19 vaccine this viral respiratory season in order to protect against what we were seeing in terms of the strains and what we thought were going to be the predominant strains. So that's why we really want everybody to get the new updated COVID-19 vaccine, even if you've been vaccinated with prior COVID-19 vaccines before, even if you've had infections of COVID-19 before, because if you had COVID-19 a couple years ago, it may not give you lasting immunity or a proper protection against the new strains of COVID-19 that are going around right now.
Right. Thank you. Let's dig into the issue of risk, which we've been talking about throughout. Because these illnesses are extremely common, it can leave people with a sense that they're not serious illnesses. Who are the people most at risk for serious illness? Dr. Makaitis, can you maybe share your perspective inside of Cook County Health on some of the groups that are most at risk for serious illness here?
Yeah, absolutely. Thank you. And hi, everybody. We have been seeing an increase in the ED with flu and RSV visits, very much so in our younger populations. Our ICU admissions are primarily children under 5 coming in with RSV, needing ICU care. We've, been seeing that uptick that Dr. Barnes alluded to right when we started. Our positivity rate on RSV, for example, has gone from 3.6 to 4.9%. So almost 5% of the folks we test are coming positive for RSV. Similarly, we're seeing in older populations and those with comorbidities or other kind of long-term illnesses where they will tend to have more issues with like COVID-19 or flu. So, those are some of the more risk factors. But I do want to say, we have seen cases where relatively healthy folks come in and they just have a horrible reaction to, any of those infections, flu, COVID. My own son was just admitted with a respiratory infection just before Thanksgiving. He spent 3 days in the hospital and was vaccinated. He's otherwise healthy. It was very surprising. And he's, 11 years old. So.
Thank you. Thanks, Dr. McCudis. You were talking about your son's experience, and we've been talking about the impacts on a variety of folks who are at risk, folks who may be immunocompromised, folks who may be older, people who live in a larger home setting. Just moving on to what are the most important things for people to know as we approach the winter holidays. As I said at the top, we're ending in the season where people are going to be at the airport for travel. They're going to be at office parties with their colleagues. They're going to be hosting events in their homes and being guests in other people's homes. So I guess I would go back to Dr. Sloboda and address it to you, and other folks can certainly jump in as well. What's the most important thing for people to know as we approach the winter holidays?
Yeah, I think the most important thing to start with is making sure you're up to date on these vaccinations. So making sure you have the new updated flu vaccine for this season and the new updated COVID-19 vaccine for this season. Anyone 6 months or older can get either of these vaccines. So many people are eligible to get them. And like I said, regardless of any prior vaccination, everyone should still get these new updated vaccines. We'll talk, I think, a bit more about it later, but there's also some immunizations and vaccines for RSV as well for older adults, pregnant people, and infants that are really important as well. And vaccines are just really nice. You just get a shot or two, and you have a lot less to worry about. So you can kind of go about your life, your activities, your work, your school, holidays, and not have to worry about it too much. But there's other ways as well. Still, masking is always a good option if you want to, particularly if you're in enclosed spaces with lots of people, or you're traveling, you're on a bus, you're on an airplane, things like that, where there's a lot of people, not great circulation. And that's why we talk about COVID and flu, RSV this time of year, is because people are indoors. This is just when these viruses are going around. So it's just important to keep that in mind. Always kind of stay like hand sanitizer, washing your hands frequently, particularly before and after eating, or if you have to touch your face or something like that. Just always kind of keeping that in mind as well. So there's a lot of those kind of activities you can do. But that's why we're really stressing we'd like everybody to be aware of these things and get vaccinated, because still young, healthy people can get really sick from flu or COVID-19. But also you don't want to make someone else sick from that. So getting vaccinated, preventing getting infections can help keep maybe someone at higher risk that you live with, someone higher risk that you work with or spend a lot of time with, keeping them protected as well. So it's really about protecting yourself, your family, and your whole community with whether it's vaccinations or just kind of doing these different practices to prevent getting infections.
Fantastic. Thank you. And I just want to jump in, and thanks to everyone for putting in your questions in the Q&A. We're getting some great questions. And some of these are different ways of asking for the same information. So I'm going to put it out to our panel here. Is the only way we can protect ourselves against illness through vaccines? If we're immunocompromised, is there any other way we can keep ourselves safe? What are some other prevention tools that we might hear? I guess, Dr. Sloboda, I'll put it to you, and then others here as well. We know vaccines are definitely in the toolkit for prevention and of serious illness, but what are some other resources available?
Yeah, so yeah, like I said, immunizations are always our kind of our front line, particularly if you're immunocompromised. Sometimes maybe you're not eligible for vaccine, but usually that's the people we definitely want to get vaccinated, is if they're immunocompromised, and they usually have specific indications. So definitely talk to your provider first if you fall in that category about what immunizations are available to you. But definitely have that discussion with your provider. Yeah, I mean, we've talked about masking. That's always a good idea. So wearing your mask yourself, sometimes you can wear those N95s, KN95s to give you a little bit extra protection in terms of viruses that may be circulating in the air. And just kind of, be mindful of your environment, particularly when you're in, like we talked about, those enclosed spaces as well, and just kind of practicing those good kind of respiratory hand hygiene practices, and kind of talking about that maybe with the people you live with and you work with as well. That is in particular important to you.
Thank you. And if there's any panelists who want to jump in, feel free.
So if I could just very quickly, everything Dr. Sloboda said, I completely agree with, right? Vaccines, hand hygiene, masking. And I think, he touched on it, but just to highlight again, the importance of having a very low threshold, especially if you're kind of younger and you feel like the sniffles or, a little bit of a sore throat. And as we're going into all these family gatherings, have a low threshold for maybe skipping that gathering and not exposing your 80-year-old grandfather or your brand new niece. It's an ounce of prevention, right?
I think I'd just like to add one more thing. I think there's now a new concept of treatment as prevention too. So specifically for flu and COVID, there are, options to get treated really fast with antivirals if you know your status, if you know that you are positive for either of them. So I think it's important to be able to access testing and have a plan with your provider if you're positive to go get treatment for antivirals. Now, for flu, you have to make sure you can get treated ideally within that 48-hour mark. And for COVID, you have about 5 days for the oral antivirals from the time your symptoms start. I know it's a big concern for those who are immunosuppressed, at least specifically for COVID. There is now a new pre-exposure prophylaxis monoclonal. It's not considered a vaccine. So that's something to, again, discuss with your provider to see, do you qualify, and advocate for yourself. We've often heard that providers are not always aware of who qualifies for antiviral treatments based on their risks. So if you have conditions that Dr. Maitakis mentioned before, and Dr. Sloboda also hinted at, you might want to talk to them right away and advocate for yourself about needing a plan to get treated as soon as possible if you are positive for one of the two, flu or COVID that we have antivirals for.
Dr. Barnes, thanks so much. And I'm going to keep you here. We've got a number of the questions that are in the Q&A and that go on the practical side, which is, how do people across Illinois access the vaccinations that they need? Are there resources that can help make that process of getting vaccinated easier for people across the state, including people who may not have insurance?
All right. So yes, thankfully, if there is a website, you go to just vaccines.gov, that'll give you the ability to locate a vaccination provider close to you. Now, in Illinois, if you have a child, so about 60% of our children are Medicaid or have Medicaid or are Medicaid eligible, and you can get what's called a Vaccines for Children, a VFC, vaccine for free. And this is through our VFC program. So if you go to IDPH and look at the IDPH VFC locator, you can find a VFC provider near you. Now, there are also programs like and services, I would say, like the Illinois Association of Free and Charitable Clinics, IAFCC, and there are free clinics, not too many, but there are a few across the state where you can get services for free. There are adult immunization programs, AIP, where previously known as 317 program. So if you qualify, you could also get vaccines at a very low discounted or free rate. So I think those are important to consider, including if you have access to go to an FQHC or places that will be able to provide you that vaccine that's embedded into the cost of the treatment instead of giving you any additional cost to it. So I think those are resources to just be aware of as far as accessing specifically vaccines for treatment. There are at least 2 live treatment access programs through for Paxlovid as well as for molnupiravir or Lagevrio for COVID specific treatments, and those are accessible to people at large. So just know that there are patient access programs for those treatments too.
Thanks so much. And I want to hand it over to Dr. Sloboda and then back to Dr. Makaitis for the city and the county perspectives for those folks who might be in the city or in Cook County.
Sure. So in the city of Chicago, we are towards the tail end of our big vaccine campaign where we do vaccines at all the city wards, many of the city colleges, many different community sites, but those still continue. So you can definitely check our website for CDPH sponsored vaccine events. And at those, there's free COVID-19 and flu vaccine for anybody who is interested. On our website, you can also find we have 3 walk-in clinics for vaccine that cover both adults and children for COVID-19 and flu vaccines as well. And we also work with a lot of, like Dr. Barnes talked about, our federally qualified healthcare centers, FQHCs, particularly for uninsured adults. It's a good place to go to get vaccines. As well. And then thankfully we do have the Vaccines for Children program. There's many of those providers throughout the city of Chicago, so that there's ample, regardless of what kind of insurance you have, opportunities there. And another opportunity is going to a pharmacy, especially if you do have, like, even if you have Medicaid, Medicare, private insurance, that's always a good option as well. But if you are uninsured, we still have many options. Just check out our website and can kind of point you in the right direction where to get COVID and flu vaccines in the city of Chicago.
Thanks, Dr. Sloboda. Dr. Makaitis?
Thank you. Yeah, so for the county, for Cook County residents, so our health centers are able to provide an appointment to anyone who wants to get one. Most insurances are going to cover the vaccines. However, we also have financial assistance programs that can cover up to 100%. So you can do an appointment through the phone number 312-864-0200. Again, that's 312-864-0200. As well, our Cook County Department of Public Health is holding vaccine clinics at our health centers. It's every Saturday through February. And you can find those dates at boostupcookcounty.com. Again, that's all one word, boostupcookcounty.com.
Great, thank you. So getting some questions about the different types of COVID vaccines. So Dr. Barnes, I'll put it to you and then everyone else can jump in. Can you talk about the differences among the COVID vaccines?
Right. So you've heard that we have our mRNA vaccine, and then we have a vaccine that's more traditionally made, the Novartis vaccine. So the two, the Moderna and Pfizer vaccines are both fairly effective and work well. I got my vaccine. I gave it to my daughter, my 3.5-year-old. And I think a little more arm pain this year than previous years, but for the most part, a tremendous amount of, I think, reassurance after looking at even the preliminary data on how this works and knowing that it targets the new circulating variant, or that the KP3 variants and that family of variants that's in circulation right now is very reassuring. So I think importantly, how do I know that this vaccine is a good match, right? So there is information both at CDC and that your health departments collect, including CDPH and IDPH. And we survey our wastewater systems to look and see what variants are in circulating and how much. We also have dashboards that are starting to trend different types of infections, not just COVID, flu, RSV. We just added, for example, mycoplasma, which is a bacteria that's can cause a lot of pneumonia, and we're seeing it in children. And so we're starting to really try to show the public where to get data on knowing what they're at risk for in their local community. More importantly, just because it's coming to holiday season and we're going to be traveling and visiting families in different parts of the state or different parts of the country, CDC now has a respiratory data channel that can give you county level data that tells you what the ER visits are really from, as far as the 3 big respiratory viruses, COVID, flu, and RSV. And so if you're not aware of that, I think it's important to be able to know that I can go here and find out what is not just my individual risk as a person, or what my different vaccines are, but also where to get that information. And I think the third thing, I know there are people who are concerned about, what if I don't respond to vaccines? Now, the 2 mRNA vaccines, and I think, as I said, the Novartis vaccine work fairly well, but we also are really thinking about the Pemgarda that mentioned. It's a pre-exposure prophylaxis. The earlier version of it was called Evusheld. People may have heard of that. It was for those who were severely immunosuppressed, don't mount a good response, and this was an option to sort of protect them. And that version didn't really work against the strains that are in circulation right now. So Pemgarda is one that has more recent FDA approval. So hopefully, again, I think the CDC website has information and also has information on some access, the ability to access some of these options. So there are the vaccines and the immunizations, which are the monoclonals. So I'll speak of that for COVID and specific to COVID, and open it up to others if they want to talk about flu or RSV.
And actually, Dr. Barnes, before we move on, because I would love the other panels to jump in, you mentioned the CDC dashboards. Can you explain what we're talking about? Obviously, the campaign is all driven by data. The reason we're doing these respiratory illnesses at this time of the year is the data shows us that we're seeing more hospital admissions at this time with seniors and folks who are immunocompromised. Can you talk about the respiratory data channels that might be available and where folks can find out more information?
Yes, so IDPH has a respiratory dashboard. I will put the links for both of these in the chat, and including CDC's respiratory illness dashboard. We also put out periodically a press release about the state of respiratory viral infections in Illinois. CDPH, I know Dr. Sloboda would speak to it more, also puts out weekly respiratory virus seasonal releases to just make people aware of what's going on right now. So there is the IDPH seasonal respiratory dashboard. You can just Google it, it'll pop up, but I'll put the link in the chat. And CDC has something specifically called the respiratory data channel, and I'll put the link to that. And you can get county level information.
And we consider those the source of truth, coming from the hospital setting. That is where all the information is stored, and that's where we go to observe the trends over time as well. So that's a great resource.
And Karen, just to follow up on what you just said, can you talk a little bit about the interactions you've had in the hospital setting with patients who come in? Dr. Barnes was bringing up the fact that the data has to be transparent and easily understood, and we've tried to put that data out there in a format so folks have questions on this call or maybe after this meeting and they want to follow up. There's updated current data showing transmission trends. Can you talk a little bit about those conversations you've had when patients have come in at Northwestern?
Sure. We definitely look at the trends, and that guides our practice and our communication with our providers in terms of, we know that the mandate for healthcare providers is not in place to wear masks, particularly at our organization. However, we are encouraging patients, if they're coming in symptomatic, to wear masks and provide those at the point of care, but is also want to encourage patients that if you don't feel comfortable and your healthcare provider is not wearing a mask, or even the check-in folks, absolutely bring that up. And we have those conversations that patients might come up and ask us to mask, and that's okay. And go ahead and put your mask on to make the patients feel comfortable and protect them as well. If they, we don't know just by looking at someone, they're either immunocompromised and might need an opportunity for the provider, and might be more comfortable for the provider wearing masks. So I would definitely encourage the public to request individuals to wear masks. We have signage about that. You have a right to ask us to wear masks, and just open that dialogue with patients and feel very comfortable about doing that.
Thank you. And thanks for bringing it up, because that addresses a couple of questions we've got here with folks that talked about mask requirements in hospital settings and their private exam rooms with providers. How do I have that conversation? What's some of the scripting that I can have so that when I'm in a private exam room with my doctor or nurse, how do I bring that up? I'm glad you fronted that to say you have to have that direct conversation. One of the questions we got, and this is, I guess, back to Dr. Barnes or Dr. Sloboda or anyone who wants to answer, where can we get Pemgarda? And is it Novartis or Novavax, or are they the same? So I'll put that up for folks.
And it's Novartis, sorry, it's the parent company. Novavax is the name of the vaccine. And I just put a locator for Pemgarda in the chat. There are very few sites where the infusion centers are available on this locator listed.
Fantastic. We'll make that gets put in the public stream here as well. If we could circle back here and talk about some of our higher risk populations. Circling back, who are the higher risk populations? And I'll put this out to Dr. Makaitis. How do we keep those in our forefront so that we remember when we walk into a room that not everybody has the same immune system and comes to the room with the same health system or public health. And then also, if we could talk a little bit about caregivers, either in a childcare setting, an elder care setting, any kind of caregiver who are often close to high-risk individuals. Dr. Makaitis?
Sure, thank you. So, again, kind of as we started, the very young and the very old are kind of the first two groups that I would think about. And apart from that, a lot of the populations that we've mentioned, right, the immunocompromised, so folks on active cancer treatment, if maybe they've had an organ transplant and they're on immunosuppression. And we also tend to see worse outcomes with folks with other comorbidities, more medical things, diabetes, obesity, lung disease, COPD, asthma, those types of things. So something just to kind of be mindful of, or it doesn't have to require, full-on active cancer treatment to maybe be a little more thoughtful about exposures and risk. And then in terms of caregivers, again, if you're in a congregate setting, if you are, working with the very young or the very old as a caregiver, right, that's, again, if possible, you should consider vaccination, possibly masking, especially if you aren't feeling well and you're the only, person available to care for the patient.
Thank you. I'm just going to take a moment to make sure I'm reading. Testing. I don't know if one of our panelists wants to speak about accessing testing. Obviously, HHS has reopened the mail order opportunity to get COVID tests mailed to your home, 4 tests at a time mailed to your home. But can we talk a little bit about testing for any of these viruses that we're talking about?
Start, and then I think hand it over to Dr. Boda for some of the CDPH specific resources. But there is also something called the ICAT testing locator, where the federal government had actually supported pharmacies and individual sites to provide free COVID testing. So I actually took advantage also of the federal free COVID tests and got myself a couple. But the ICAT testing sites, at least as far as the current support is concerned, they're still active. Hopefully for the next few months, they will remain active. And I'll put a link to one of those ICAT locator sites so you could find out where you can get free testing. But we have also Cook County Health, which is also a great partner for a lot of testing work that happens here.
Dr. Sabota?
Yeah, I think, the federal government, the at-home tests that you can order is a great resource. Point of care COVID-19 tests are still widely available at pharmacies as well. Usually it's more the COVID-19 tests that are available to do at home. There's also obviously tests for flu and RSV. Usually those are performed in a healthcare setting. A lot of times they're performed as like a triple test. You get it has both, it's like one swab, they test for COVID, flu, RSV. Those are done a lot of times in like primary care settings or emergency departments as well. But a lot of it has to do with how you're feeling. If you're feeling really severe to the point where you need to go see a physician or a provider or need to go to the emergency department, that's kind of the most important component of it. And then that's where they perform the test to see which of these viruses, if any, or if it's something else causing these symptoms. So of that aspect, it's really the severity of symptoms during this time of year. If you're feeling just like some sniffles and stuff, it's not necessarily super important that you get tested. It's more so staying, like we've talked about before, staying home from work, from school, making sure you're not going to those places if you feel sick and getting other people sick is kind of a big part of it.
Right. Thank you. More questions coming in. Are the flu and the COVID-19 vaccines a good match to what's circulating in the community right now? I will have Dr. Makaitis take a first stab at responding to that.
Sure. I think I would defer to my public health colleagues a little more, but I think by and large, yes. As Dr. Sloboda said, the COVID-19 vaccine has really tried to follow the evolution of what we've seen with the virus. So the COVID-19, absolutely. And I know flu can be hit or miss sometimes year over year, but it still offers some protection no matter what. And this year, I think, has been a pretty close match. But again, I would defer to our DPH colleagues.
And I'll only add that, yeah, they revised the flu strain this year, so they actually look at what's happening in the southern hemisphere. They have winter first. We see what's going on there. They tweak the strain, and again, as Dr. Maikata said sometimes it's a hit or a miss. We'll probably know when flu season peaks. We haven't seen a peak yet, but it's also thankfully been milder in general. And so that's also reassuring to us as far as, not seeing a lot of severe illness from flu, which is really what the vaccine is designed to do. And I think one thing, there are so many benefits to vaccination beyond just protecting from communicable diseases. So specifically, the flu vaccines have been known to protect or improve your risk from heart attacks and strokes. So that's large population level data. So I wish more people were comfortable getting the flu vaccine. I got mine this year again, try to promote it to a lot of people, but there are benefits beyond just targeting just this one specific strain that might be in circulation each year.
And a question that's not in the chat, but I thought folks might want to know, because you mentioned your experience, and I've been vaccinated as well. Can you receive one or multiple of these vaccinations at the same time?
I could take that one. So yes, we actually really encourage particularly getting the updated COVID and flu vaccine together, because both of them might make you feel a little under the weather for like less than a day, some muscle soreness in the arm where you get the injection. So yeah, it's what we do in all of our clinics, is offer it at the same time. Maybe someone already got one and just needs the other. But yes, very safe and effective to do both of the updated COVID and flu vaccine at the same time.
That's great. How late is, as I mentioned, we're into December here. How late is too late to get vaccinated and to have the vaccinations be helpful in reducing the risk? How late into the season can we go?
I can take that one. So obviously, we always want people to get it as soon as it comes out, really. So, but now is a perfect time to still get it. It does take a couple weeks for the vaccine to work and create that immunity to give you the full protection. But yeah, you can still get it now. You can still get it throughout kind of what we call the viral respiratory season into like March, April, May. But as always, we always encourage to get it early on this season, so it can kind of give you good protection throughout the season. So, but right now is a great time to get the COVID and flu vaccine and the RSV vaccine if you're eligible for it, particularly going into a lot of different holidays in the next month or two, where we're doing a lot more activities and getting together with people just to give us some more protection and peace of mind.
That's great. Any panelists want to jump in onto the seasonality of it? It's not too late, folks. If you haven't gotten vaccinated, go in.
Exactly what Dr. Sloboda said, but I think one thing to remember, some high-risk populations like pregnant women can get their flu vaccine a little early, like, as soon as it's even out. And COVID has not been as has had as deep of a dip during the summer as we often hope. So there are recommendations often that come out for special high-risk populations to get an additional dose, especially for COVID vaccine. Flu has been fairly traditional, and at least the last season, RSV has been fairly traditional. So you may have heard, at least for the infants and for pregnant people, RSV vaccine is, September to January for pregnant women, and from October to March for the babies that are born in that time frame. So different, you might have a provider that might be able to provide medical justification for a later vaccine, but sometimes I think that becomes harder from an insurance standpoint. And there are some access implications past those periods.
That's great. We've been talking about COVID-19 and the flu. So let's talk about RSV for a minute. We've gotten a couple of questions about the RSV vaccine. RSV vaccine is a newer vaccine. Many people probably have questions about this illness and how vaccines can help protect people. Can you talk more about what RSV is and who's most at risk?
Yeah, I can start with that. So RSV is a viral infection that impacts your respiratory tract. It's a very, very common virus. It's been around for a long time. I think it's just getting, after we've had flu for a long time, we had COVID. Now there's more attention to RSV, but it's a very common virus. Most people will get it if they're young and healthy, and it'll just give them the sniffles. It'll give them the common head cold. The CDC estimates that literally every child in America will have an RSV infection by the age of 2. So it's just something that's always going around. What we're concerned about is people, like we talked about on the kind of opposite ends of the age spectrum. So older adults and very young infants are the ones that are at risk for the severe illness. And so for older adults, particularly those 60 and older, that's a high risk group. They can have maybe worse symptoms and outcomes. That's the group that it may impact their lungs, not just like their nose and their throat and a cough and things like that, but it might make them hard to breathe, might give them other bad bacterial lung infections on top of it. So that's a group that often ends up hospitalized from RSV. So that's why there's a vaccine for them to prevent that. So there's two kind of groups. There's 60 to 75, and they can get the vaccine if they have certain medical conditions like heart conditions, lung conditions, immunocompromised, or if they live in like a congregate setting like a nursing home, or anybody 75 and older can get the RSV vaccine as well. Currently, it's just a one-time vaccine. You don't need to get it every season. They're obviously studying it as they go along to see if maybe you need boosters or a repeated vaccine or something like that. But right now, if you got it last season, you're so good. You don't need to get another dose of that. So there's two of those. There's a RSV and a Brisvo. The other group is pregnant people and infants. And so there's a vaccine for pregnant people, and the point of the vaccine is to protect the infant once it is born. So a pregnant person can get the Brisvo vaccine 32 to 36 weeks of pregnancy, and then that vaccine will cause an immune response, and then antibodies will pass to the infant during the pregnancy. And so once the baby is born, it already has the protection and the antibodies from the mother to protect them from RSV. In the event that the mother did not get the Brisvo vaccine during pregnancy, that's when they need something called nirsevimab, which is kind of new. But all these vaccines and immunizations are new in the last couple of years, and we're really excited about them because RSV really impacts these populations. So they can get the nirsevimab, and it's literally antibodies, monoclonal antibodies. It's not a vaccine. So especially when you're really young, you're just born, your immune system's not fully working yet. It takes time to develop. And so instead of giving a vaccine that causes the body to make antibodies, we literally just do an injection of the antibodies to immediately provide protection to the infant after they're born. And so RSV has a huge impact on infants in the healthcare system. It's the #1 cause of pediatric hospitalizations for those under 1 year of age is RSV. So it has a big impact, and many people are impacted. Many healthcare systems are impacted by this. I work as an emergency medicine physician during bad RSV seasons. All the pediatric ICUs in the city are full. Sometimes all of them in the state are full. And it's also a really scary disease when they're really young. It can look like a really, really bad asthma attack. They're wheezing really bad. They're struggling to breathe. So that's why we want to prevent this. Obviously, if they get to a hospital, we are really good at treating RSV in infants and giving them oxygen and help breathing. But based on last season, looking at the data so far, it looks like this nirsevimab, these antibodies, are 90% effective in preventing hospitalization, which is outstanding because it's a very scary illness, has a big impact on the healthcare system. So if there's something that's 90% effective in preventing that, that's great. So yeah, if they need to get the antibodies, that nirsevimab, it's best to do it as soon as possible after birth. So that's why in Chicago we're working with healthcare systems and birthing hospitals to try to get it administered right after birth, so they don't have to worry about it anymore. They got that protection going for the first couple of weeks of life, but they can get it up until a week into life, that nirsevimab. But for whatever reason, if they miss getting it in the first week of life, or they were born before RSV season in the spring or summer, you can get it up until 8 months of age. So this is a really important discussion to have. Either if you're pregnant and during pregnancy, are you going to do the vaccine? Are you going to do the antibodies once the infant is born? Or if you just happen not to get it, following up with your pediatrician or provider to make sure to get that protection for your infant, particularly in that first 6 months of life. It can be really dangerous for them to get RSV.
Thank you, Dr. Simona. We were just talking about the conversations that patients have with their providers, but we also have conversations with our own family and friends. So some of the questions that have come in the chat here have dealt with that. How do I have these conversations? So I guess I'll put it to Karen Podolsky. What can I tell my friends and family who might be concerned about safety based on misinformation, and what resources are publicly available that I can direct them to for more information on vaccines?
That's a great question. I think providing the information, so folks, sharing your thoughts and your ideas about vaccination, the things that you've heard, but also the concrete information that is available. And there are some great resources on the HHS website available about the misinformation, things that people might, theories and thoughts that people might have, but actual information to come armed with. And, it's a difficult discussion whether or not you want to put yourself in activities with this individual, right? So I think especially around the holidays, if there's a way to provide the information up ahead. If somebody's completely resistant, I mean, it's a decision you're going to have to make whether or not you want to hang with them, right? It's kind of opportunity out there. So I think the conversation twofold: one, coming with information how you feel personally, as well as information that's available, concrete scientific information with rules and or guidelines around that, and I think that would be helpful.
Artie Carbonargi, you're on mute.
Sorry. This is a common question we're getting in the Q&A here is how can I have resources available to me to have these intelligent conversations, not just with people in my life, but maybe with my provider, my pediatrician, the FQHC that I'm go to for my healthcare. So I guess Dr. Makaitis, Cook County has a very large, diverse healthcare system. What are some of the different ways that are resources that are available for patients to get this information? And in the Cook County system, what are some ways that you're encouraging vaccine information?
Absolutely. So we have the websites that I mentioned already, right? boostupcookcounty.com. We also have printed media in our clinics, and obviously lots of conversations and training with our clinical staff. And, again, right, I think Karen touched on it. There's a lot of online media that is very helpful. CDC, HHS, your local health department, they all have resources that kind of set the record straight in terms of misinformation. And beyond, I think just kind of that safety misinformation, I think there's also kind of misunderstanding too that we've seen. For example, folks may think, well, I got the flu shot last year, I don't need it again this year, type of thing, right? But there's that just a little bit more of that deeper understanding that, it changes every year. It's more effective if you're current on the right. You got to keep up with the new versions, right? So beyond just kind of that broader misinformation, again, making sure that the more basics in terms of understanding, why the cadence and all of that, and that, once a couple of years ago isn't good enough. So.
Thank you. Well, I want to give each of our panelists time for a wrap-up comment. If there's a point that they'd like to reemphasize, or if there's a point that has been made. Dr. Barnes, I'll start with you. If there's any wrap-up comments you'd like to make, we'd love to hear them.
Just want to say again, thank you for those who took the time to attend today. And just an important reminder that vaccinations do work, but there's so much more out there, including knowing where to find information, where to get tested, where to get treated, how to protect yourself and your loved ones, masks, hand hygiene, and staying home or staying at least away enough from others when you are sick with something. So they have so many tools in our arsenal. We owe it to ourselves and our communities to just be able to use all of them. So thank you again for your time today. Appreciate it.
Thank you, Dr. Barnes. Dr. Sloboda?
Yeah, thank you for having me. And yeah, we just want everybody to feel safe and protected this winter viral respiratory season. So big part of that is these updated vaccines to cover for the circulating flu and COVID viruses. So we just strongly encourage for everyone to consider getting these. And it just makes life a lot easier, gives you that protection. So you have less to worry about, much less likely to get sick or very sick from COVID and flu, and also less likely to get others sick. But also just, practicing other good practices to prevent the spreading of viruses. But we really just want everybody to have a healthy winter season so that they can enjoy being with their family, their loved ones, being able to go to work and school and things like that. So thanks for having us.
Thanks, Dr. Sloboda. Karen?
Great. Some great comments already. I just want to reiterate just the information that is available from CDC, Health and Human Services for resources. Federally qualified health centers just are ready and at the waiting for those that are uninsured to provide the resources available for that. And there's some great comments and questions and taking back and things gave me pause to actually think about personally as a provider. So I want to thank those that took the time to share the information specifically about the masking and asking other individuals to mask up and how we have those conversations. So thank you very much for sharing those comments and questions.
Thank you. And again, shout out to everyone who took a time to put a question in the Q&A. I've tried to do my best as I can to consolidate those and get those asked to our panels. So thank you for sharing. And Dr. Makaitis for the closing words.
All right, thank you so much. So again, thank you for hosting the event, and thanks to everybody for joining. As everyone has said, right, if you can get vaccinated, the sooner the better, right? It takes a little bit to kind of gain that immunity. So you want to do it sooner rather than later. We're heading into much colder weather, most likely, and the holidays with additional exposures. And as everyone else said, mask, hand hygiene. If you are feeling sick, sit this one out maybe. And for those in Cook County, just one more time, I want to plug, if you need a vaccine and are interested in an appointment, it's 312-864-0200. Or if you want to engage through our Cook County Department of Public Health, that is boostupcookcounty.com. Thank you.
Thank you all. So many thanks to everybody who joined our discussion today. I'd like to especially thank each of our panelists, Karen and Dr. Sloboda, Barnes, and Makaitis, for participating and sharing your perspectives. And for our attendees, we encourage you to tap into the resources offered by HHS via the Risk Less, Do More campaign at risklessdomore.hhs.gov. We'll follow up with all of those who registered with the links to resources that were shared in the chat box during the conversation. Thank you again for your time today, and I'm wishing everybody a safe and healthy winter.